Okay, so this talk's going to be focused on primarily the hip during walking. So here we have the hip angle, moment, and EMG data. So we have angle data here, moments, and then EMG. And we're going to focus on the EMG, the angle. We're going to focus on the angle first. So we see initial contact. And what's remarkable is that at initial contact, you have about a 30-degree hip flexion angle. And then during loading response to 10% of stance, the hip angle is pretty static, which kind of shows you that most of the adaptation of putting the foot to the ground happens at the knee and the ankle, and that the role of the hip during this first loading response phase is going to just be mostly gaining stability for single leg support. Once we've hit that 30% point, or once we start to enter into single leg support at 10%, we notice that there's rapid hip extension till we achieve about 10 degrees of hip extension at the peak of really at pre-swing. So we have rapid hip extension until pre-swing of about 10 degrees. And then after that peak, we have rapid hip flexion, which really plateaus at about 30 degrees, a little over 30 degrees at about 82% of the gait cycle. So just at the transition from mid-swing to terminal swing. And then we see this kind of small amount of motion where the hip is extended, placing the foot onto the ground. So let's kind of look at the different moments that are associated with some of the phases here. And remember that essentially we land, the key kinematics are that we land in 30 degrees of hip flexion. That's fairly static until we reach foot flat or opposite toe off. Then as we go into single leg support, throughout single leg support there's rapid hip extension until we enter double support again at 50% of stance at the beginning of pre-swing, at which time we have rapid hip flexion that's arrested around the transition between mid-swing to terminal swing, and then we have a slight amount of flexion, and then we have a slight amount of extension to place the foot on the ground for the subsequent heel strike. Okay, so let's take a look at these loading response and mid stance. And so essentially, let's divide that up here and then kind of look at the hip moment data here. And extension is negative again, and flexion is positive, just like the other graphs. We have the iliopsoas EMG and then the glute maximus EMG here, so flexors and extensors. So we can see really there's agonist contraction here during loading response, and then all the way up to about just beyond the transition from mid stance to terminal stance. And so then what we see is start to see this kind of shifting, about halfway through this rapid extension, we see this shifting to a different agonist moment. So let's look at the EMG, and here for the most part we don't have much co-contraction. It's all large gluteus maximus contraction throughout this loading response phase, and then really all the way till about 30, 5%, or more of stance. And so essentially the glute maximus is really the agonist from loading response through mid stance. So that's kind of a pretty simple explanation. And then as we start to get into terminal stance, what's going to happen is our moments shift, and we'll see here the EMG is going to also change. And just note this is before we get to peak hip extension. So now we can kind of see what's happening is we've kind of now shifted to just past the transition from mid stance at 30% to terminal stance, which ends here at 50. We kind of notice that's where it peaks. And we notice that essentially as we go from the rest of this kind of rapid hip extension, the second half of it, that happens in terminal stance, is really controlled by the iliopsoas muscle. So we have the hip flexors of the agonist. We have a fairly strong iliopsoas contraction here. And so that's eccentric contraction here of the iliopsoas controls that forward progression of the hip into full extension at minus 10 degrees. And that's immediately followed, so we see here's our peak moment, and that's immediately followed by rapid hip flexion. So we still have the agonist here that, advances the limb, flexing the hip rapidly. And then about 73% of stance, we still have a hip extension moment, but then as we transition from an initial swing or early swing to mid swing, we're going to switch agonists again. And so then here's terminal swing, mid swing and terminal swing, and so we can kind of see the moment data here. Now we have hip extensors are the agonist, and we can kind of see the kinematics kind of plateau out about the transition from mid stance to terminal stance right here, arresting the motion of the femur, which then allows the tibia to swing forward into extension. And we can kind of see the glute max is contracting here as a hip extensor early, but if we superimpose the hamstring muscles, they would also be active here and could contribute to that limiting activating hip extension or the hip extension moment. So this is a combination of glute max and hamstrings. And then I think subtle but important is that people talk about this last little kind of hip extension that occurs. People talk about the landing as a shock, and certainly you have to have some kind of impact to put the foot on the ground. But I think most of us would agree that the landing is fairly smooth, and this is a kind of one of the subtle angles that happens to make that smooth. So in essence, the hip extends just ever so slightly as the heel's hitting the ground to place the foot on the ground rather than have it just be kind of a random fall. And so that's the importance of this slight hip extension at in the terminal swing phase of the gait cycle. Okay, so what we can do now is kind of look at the joint powers, and then that'll help us kind of understand what the eccentric, concentric control and review what's happening in terms of the muscle function at different periods of the gait cycle. So we'll just review for kinematics at the hip. We have 30 degrees at initial contact. That's flexion. That's maintained till load and response. We have rapid hip extension till we get to minus 10 degrees. At the transition from terminal stance to pre-swing, we have rapid hip flexion again until the transition from mid-swing to terminal swing. And that peaks around, pretty just above 30 degrees. And then the hip sets the foot on the ground by just doing a little slight hip extension right here at the end. And so if we kind of look at this kind of power graph and how it kind of relates to the kinematics, we can kind of see that this very first period where the hip is stable at 30 degrees during load and response, we can kind of see that it's really as an isometric contraction at this kind of first power burst. And that's followed by a fairly large 2 watts per kilogram and significant concentric power that goes until about 35% of stance, so just past throughout mid stance and then just into the early part of terminal stance to kind of progress rotate the femur to a vertical position and progress the trunk forward. And then just as we get into that early part of terminal stance, the agonist switches to the hip flexors, and so then we see a negative power, which here means this is a eccentric contraction of the hip flexors to control forward progression of the trunk. So I'm going to come back to this in a minute and draw this out. So right after that eccentric contraction for H3, which we see here, we see an immediate concentric hip flexor contraction here. So we have a concentric hip flexor contraction here, which then rapidly flexes the hip, okay, which then is arrested about the transition from mid-swing to terminal swing. So we get one more power burst, which is positive hip extension, placing the foot on the ground. Okay, so I'd like to circle back to making sure people understand this switch here from concentric hip extensors here to eccentric hip flexors here. And so I'm going to kind of relate to these two drawings here. I'm going to put them over here. So at 30% of stance, essentially, I'm basically feet adjacent, and so my trunk is directly over my foot. And so the hip moment is very close to neutral, and so that's kind of very close to this kind of location. So essentially a little bit past feet adjacent, because 30% would be that transition point. And so as I go from this position to having my pelvis or trunk slightly in front of my stance limb, so now what's happening is my trunk center of mass is in front of my hip, and so my trunk is essentially extending my hip. So at this point, the hip flexors are the internal moment that's controlling this hip extension that's occurring from 35% of stance to 50% of stance. So that's an eccentric contraction. So this is usually a little bit more difficult for students to understand, but the key thing is that if you're vertical and then you kind of fall forward with your knee straight, what you'll see is that this is an eccentric hip flexor contraction. And that's what this is, power here. This is a negative power associated with this part of the hip flexor moment graph. And that's immediately followed by a concentric contraction. So again, that's a stretch shortening cycle. And then this is shortening. So here we have the eccentric stretch followed by the concentric shortening. So we covered this as a key important element of gait for the ankle, knee, and now the hip. So this first element, okay, so from 15 to 30% of stance, when the tibia is stable, we need the femur to go from posteriorly rotated this way to rotating anterior and becoming more vertical here. And so we talked a little bit about how the quads do that, but then now we're kind of looking at how the hip extension weakness is also going to be part of this. So essentially you're landing with an initial contact at 30 degrees of hip flexion, and so at loading response with foot flat, you're still at 30 degrees of hip flexion. And so in order to get to this vertical position, that during mid stance and then throughout all of terminal stance, the hip has to extend rapidly. And the first half of that extension to getting vertical will be from concentric control of the hip extensors and then the second half will be eccentric control from the hip flexors. So it should be obvious to you that this first transition from loading response to mid stance is a critical point when a lot's going on in terms of control. And the key issues here are stability at the hip, in terms of a significant enough hip extension contraction to maintain that isometric position of the hip for loading response, and then give a large concentric burst through mid stance. And so you can kind of see that this particular transition from double limb support to single limb support is critical and requires the tibia to be stable, a good quad contraction, this is misspelled, which is interesting, and ankle motion that allows some dorsiflexion of the tibia on the fixed foot, and then adequate hip power. Okay, so let's go to our pathologic gait example. So this is that same kind of double support, initial contact point of the gait cycle. And we can kind of identify that again by looking at both limbs and kind of knowing what we know about normal gait. So we can put the hip joint here, the knee joint there, and then we can kind of look over here and say, okay, so this is about this transition. So we should have about 30 degrees of hip flexion. And so what we could say is at this loading response phase that there's kind of probably more like 20 degrees. So there's decreased hip extension at the loading response for this particular patient. Second, we would look at the second frame of a pathologic gait example, and we can kind of see, what the phasing is again, and we're at 35%. So we're here, and we expect the hip to be kind of moving into extension, and we can kind of see here, essentially we are getting some extension from the hip at this point. So it may even be more than we would like, but we're at least in some extension at 35%. So 35% with some extension. So fairly subtle differences here. So we would just call them close enough. Okay, so let's go back now and do the moments. So again, we could put a center of pressure there. We could put a center of mass here. We could draw the arrow up, and then we could put the hip here. Okay, and so what we can see here is that the ground reaction force is anterior to the hip joint center, okay, but not very far. And so essentially it looks to me like, the shortened stride length and decreased angle is causing a decreased hip extension moment. So a sign that the person had adequate strength would be whether or not they took a big stride and then were able to kind of get into single leg support on that leg. So what you'd have to do to verify that, though, because it could be caused by other things, to verify that, we do a manual muscle test for hip extension. And in this case, my guess is that's not what's causing the decreased hip extension or hip flexion at this point of stance. It's more the fact that the tibia won't dorsiflex or anteriorly translate, so we don't get this kind of tibial progression, which allows the hip to go into flexion. But both of these could cause weakness, or lack of tibial progression could cause that decreased moment and decreased hip angle. So we can kind of look at our ground reaction forces again here. So we can put the center of mass up here around L4, and then draw the line up there the vertical ground reaction force, and the hip is harder to find in terms of its joint center, so it's right here. So what we could say is in this particular case, the ground reaction force is still anterior to the hip, so the external moment is in flexion, and the internal moment is in extension. But the moment's pretty small, so we could see as if the person was able to dorsiflex here, that they would, pass the ground reaction force here, posterior to the hip joint, and then these would switch. So if we kind of look over here at 35%, which is where we think this part of the gait cycle is, we can see this is really the transition from a hip extensor agonist to hip flexor agonist. So this patient's pretty much right where they need to be. It's the question is, are they actually going to allow the ankle to dorsiflex so that they can get the joint center here in front of the ground reaction force, so that we can then switch from an internal extension moment to an internal flexion moment. Okay, so that's all for the hip.